Hello all, my name is Arkel Washington and I am presenting the country Namibia for my World's AIDS Day project. The people of Namibia pride themselves on their beautiful scenery, including the Kalahari Desert, and is also known as the Gem of Africa due to its natural wonders. Being well known for its beautiful scenery and attraction to ecotourists, there is no denying that there is a major epidemic invading this country. I have created this presentation with the aim to spread the awareness of HIV and AIDS prevention in hopes to reduce new cases from arising to the point of complete elimination. Namibia is located in southern Africa and borders the South Atlantic Ocean and other beautiful countries such as Angola and Botswana. Half the size of Alaska, Namibia is the second least densely populated country on Earth with just over 2 million people in its population. Shockingly, Namibia has the fifth highest prevalence of HIV and AIDS in the world, following Botswana and South Africa. In 2017, the population of Namibia was a mere 2,484,780 people. 230,000 of those people are currently living with HIV. That's almost 10% of the total population that is currently infected. There are 5,000 new infections in Namibia each year. In 2016, 4,300 people died of AIDS alone. In 2016, there was major progress towards the 90-90-90 target. In comparison to 2015, there was a 4% increase to a total of 70% of people living with HIV who knew their status. There was a 5% increase in those who know their status and are on antiretroviral therapy, also known as ART, and a 3% increase to a total of 82% of people on ART who achieved viral suppression. The main modes of transmission are heterosexual sex and mother-to-child transmission, and there are a number of issues that drive that epidemic, including multiple concurrent partnerships and intergenerational sex. Women are at a higher risk of contracting HIV, resulting mostly on the choice of their partner rather than from their own behavior. Two subgroups of women were found to be particularly vulnerable to HIV infection: young, educated, employed urban women and young, married, cohabitating women, particularly poor and uneducated. Systematic data on HIV prevalence rates and risk behaviors amongst key populations and vulnerable populations at higher risk are not currently available in Namibia, and incidence by modes of transmission is unknown. However, one limited independent study undertaken in 2008 found a prevalence of 12.4% amongst men who have sex with other men, and a 2012 rapid assessment using focus groups established that children as young as 10 years old could be involved in sex work in Namibia. Another risk that has been mentioned is mother-to-child transmission. The coverage of pregnant women who receive antiretroviral drugs, also known as ARV, for prevention of mother-to-child transmission increased 2% to a total of 76% in 2016. Also in 2016, an estimated 270,000 new HIV infections were completely averted due to prevention of mother-to-child transmission. While multiple concurrent partners, particularly with men having concurrent relationships and a high partner turnover, as well as vertical transmission, which are significant factors in the spread of the epidemic throughout Namibia, certain regions in the country are more affected than others. HIV prevalence has been consistently higher in the northern area of Namibia since 2004. The northern regions where the HIV prevalence is highest are also the most densely populated. So what is being done to prevent the spread of HIV? The United States President's Emergency Plan for AIDS Relief, also known as PEPFAR, has contributed over $800 million in grants to Namibia for HIV/AIDS research and relief, and just $213 million in 2013 alone. In 2004, PEPFAR partnered with multiple organizations such as Government of Namibia ministries and agencies, non-governmental agencies, and faith-based organizations. These organizations help coordinate programs that treat adults and children with advanced HIV infection through antiretroviral therapy. They test and counsel adults and children with HIV. They also test and counsel pregnant women for HIV and AIDS, provide HIV-positive women with antiretroviral drugs to prevent transmission to their children, as well as training health care workers to improve HIV and AIDS services. They also provide grants to mass media entities to further public communication with a major focus on prevention, treatment, and care of HIV and AIDS. So how have numbers improved? There are currently 411 clinics, hospitals, and etc. that provide antiretroviral therapy and other services to persons with HIV. With numerous testing sites available, there were 209,103 HIV tests performed in 2014 alone, averaging out to about 17,400 tests a month. There is PrEP availability, also known as pre-exposure prophylaxis, to lower the chances of high-risk individuals from getting infected with HIV. In 2016, 70.3% of individuals used condoms. The Ministry of Health and Social Services provided about 100,000 condoms a month between 2014 to 2016. We also saw a trend of male circumcision begin to rise. Circumcision jumped from 18,549 in 2015 to 27,340 in 2016. That's an 11% increase in just 1 year, which is a total of 25.5%. Thankfully, with the relief efforts of the United States Agency for International Development, the Center for Disease Control and Prevention, the Peace Corps, the United States Department of State, and the United States Department of Defense, Namibia has been able to stabilize and decrease the prevalence of HIV and AIDS that has terrorized their beautiful country. Although there are still 75,975 people in need of ART, there are currently 67% of those who know their status and are currently receiving antiretroviral therapy in 2016, including 4,025 newly diagnosed individuals. With 154,025 people receiving from some form of health care due to HIV and AIDS, the country spent about $213 million on health care in 2013 alone. Please take some time to view my public service announcement for more information on how to prevent the further spread of HIV and AIDS, and thank you so much for your time. There are 5,000 new infections of HIV and AIDS in Namibia every year. That's 416 a month, 104 a week, 14 people a day. Do they really have to tell you? Are you too afraid to tell them? If you don't know where it's been, wrap it up. You don't have to go alone. Be a friend, find a friend. Visit your local clinic or hospital for prevention methods against HIV and AIDS, such as free condoms and free information. Remember, it stops with you.